Okay, so here's my 3 things that you need to do to get patients better. How many of you out there have ever felt bad for doing hands-on therapy because it wasn't evidence-based? When I was in PT school, my professor said, oh, you guys should go check out the new EIM blog. And the post that day was a post slamming one of my mentors, John Barnes. And it was just like, and they've since taken down the post. It was funny, it was crazy. It caused a firestorm because what he was teaching wasn't evidence-based. But look, here was the guy that taught me how to treat patients and do things. So my patients tell me, I've been to PTs for years, and you're the first person that's touched me where I hurt. You're the first person that's done something that's helped me. Now, look, this isn't my opportunity to go and defend someone, but it's like, this was my experience as a PT student, and I come out of school, and that's all that's being put out there is just, evidence shows this, you shouldn't do these other things. And yes, there are people that meet in the middle, but who are the loudest voices? But they're missing something, and they're why I am busy. Because people come to see us because they haven't been touched. I've seen patients where I've asked them, I said, there's like, oh, I think I have a meniscus tear. I know I haven't. I was like, well, have you got an MRI? No. I've got knee pain here. Did your orthopedic surgeon do any hands-on testing? No. No one ever touched them where they hurt. Well, yeah, the MRI shows a meniscus problem, but if I can press on them somewhere and it relieves the pain, like, don't we all know now that it doesn't mean it's a meniscus problem? Evidence is great. Evidence is great, but if you're listening and you feel like I shouldn't be touching patients, don't listen to those people, because people need to know you know where they hurt. Okay, so here's my 3 things that you need to do to get patients better. Listen, touch, and empower. And the 4th thing, listen, touch, empower, but the 4th thing is you got to ask. Learn how to ask the right questions. So listen. You need to have time to spend to listen to people. It's probably one of the most valuable things that we do. Look, I got 45 to 60 minutes. Like, we do a 45-minute treatment. If all I do is sit there and listen to people, they'll happily pay. Because guess who doesn't listen to them? The PT at the mill and doctor orthopedic surgeon. They don't listen. When's the last time you went to see the orthopedic surgeon? How much time did they spend with you? Even if you weren't there, if you were there as a patient, not to market your business. Look, even if we're only going to do exercise, I got to put my hands on you. It meets your affective needs. Shout out to Bob Duvall at Sports Medicine Atlanta, taught me that one. You just got to meet their affective needs. They need to know you know where they hurt. We can't just talk about it, show it on a screen. Here's the other funny thing. I saw a patient. She was referred. She wasn't referred to us. No one's referred to us, but except by their friends. She found us, and she came in to see me. She had a double knee replacement, and she was in physical therapy. I can't remember how long. I'd have to look at her chart, but it was long enough that they discharged her because she was done with physical therapy. What was done with physical therapy? She wasn't going to gain any more range of motion in her knees. She was at 90 degrees, and guess what she did for a living? She was a firefighter. She's actually captain. She leads a team. She's got to drag a 170-pound dummy up 2-story ladder and 100 yards. And she's got to do that to qualify. She didn't have to do that to work, but she really needs to be able to do that. To be the leader, she's got to be able to, lead from the front. So she comes in. I'm like, what? I'm talking to her, asking her all the right questions, and she's crying and just like, I'm never, this is my job, this is my life. I need to be able to do X, Y, and Z. And they told me, physical therapy, you're done with physical therapy. There's nothing more we can do for you. And she's like, I just need some hope. I'm like, all right, well, let's see what's going on. I lay her down on her back, and she's in her shorts. I'm looking at her knees. Okay, they're a little swollen from surgery, but it's been a good 2.5, 3 months. She's probably, she's not past 5 months. But she had just finished her 3 times a week on the bike, ice pack, heat stim. Who knows what the hell they were doing? Because they certainly weren't helping her. Because I'm going to tell you why in a second, why I know this. She lays down and she says, here's where, I said, where do your knees hurt? She points. She points. Let's see, can I get my, kind of like back of the knee, right where the hamstring's attached. I'm like, huh, okay. I test her knees, 90 degrees. All right, kind of stiff. All right, where does it hurt? Okay, I take my thumbs and I press into her hamstring, and guess what? Her knee goes 110 degrees. 90 to 110 in like 30 seconds. I'm like, huh, okay. Let's go around to the other side, test the other side. It didn't hurt as bad, but I didn't get 110. I got 100 degrees out of it. I got another good 10. So right, 5 plus or minus 5 is the standard. And who are these people telling her she was never gonna get her knees to bend any further? So we did some hands-on mobilization, some MFR. I did some, gave her some exercises and self-treatment to do at home. And after 3 visits, she called us to cancel her 4th. Why? Not because we weren't getting her better, because there's fires in California and I'm going with my team out to out to fight fires. Well, look, she needed to be able to squat. Who the hell didn't actually touch her where she hurt and help her get some more range of motion? Somebody. Look, I don't care what you're doing. If you can't spend 3 minutes touching someone, you're not doing physical therapy. 5 minutes, like what? I touched her for 5 minutes and she got 20 extra degrees of range of motion. Remember, she had a bilateral knee replacement. It's not the only time this has ever happened to me. I've been doing this for long enough. I'm guaranteed if you're listening to this, it's happened to you too. Someone else has missed something. Well, yeah, you can miss something, but it doesn't happen over and over again if you're doing good quality physical therapy. And you may be the best physical therapist and you don't have time. Look, you only have 15 minutes for people. You can touch them where they hurt. All right? We kind of went to listen. I got to have time to listen. I don't have to have that much time to touch them. What do we all do? We empower our patients. I don't want someone to come and get a massage from me every month because I'm not a massage therapist anymore. I want them to come once a week, but I want them to learn to take care of themselves. I want them to learn to treat themselves, to improve themselves, and they need to come see me every once in a while to get a kickstart or get to the next level. I have no problem with that, especially even if it's once a month for some people. I have no problem with that. And the 4th thing really is you have to learn how to ask the right questions. And these aren't the questions that you were taught in PT school. These are the questions that you ask where you get people to open up and share with you why this is so important for them to do it anyways, because that's what's going to get them compliant. But when you know why, if you get to the point where they're about to cry because you're the first person that sat and talked to them about this ever, they'll give you whatever you want when you tell them you can help them, because really all people want is to know that you heard them, to know that there's hope, and they're not the worst someone's ever seen. Like, I don't know what the fuck that means. You've got the worst spine I've ever seen. Like, why would you ever tell someone that? All it does is make people feel like shit. So if there's one thing that needs to change on the medical provider side, it's stop telling my patients you've got the worst blank I've ever seen. It makes me want to vomit every time I hear that. I mean, that's it. Look, go do whatever it is whatever kind of treatment resonates with you that helps you get results. Like, yeah, there's some treatments out there that are BS. I'd never do them. You might think that they're amazing. Look, it doesn't matter as long as your patients get results. I mean, your patients get what they want. Does it matter what I do? Well, look, if you're not touching patients, they're all going to come see me. They'll eventually find their way to see me if you're not touching your patients where they hurt and doing some kinds of hands-on care, because that creates connection. They know you care. They know you know, and number 3, where they hurt, and that makes all the difference.